Sounds great.
Hi, I'm Dr. Jason Almling, and I'm with Trinity School of Natural Health, and I wanted to welcome Dr. Michael Wald, and he's going to be speaking this evening for Nutritional Frontiers about neuroplasticity. So I'm going to turn it over to you, Dr. Wald, if you want to take the floor.
Thank you very much. It's really a pleasure to be speaking about this particular topic to such a distinguished audience, both naturopathic students and naturopathic clinicians and whoever else might be listening. The concept of neuroplasticity is fundamental to all health and well-being because, as everyone here listening knows, the nervous system is central to control of the body. What I intend to do over the next 45 minutes or so is to give you an extremely advanced presentation that's both clinically practical and also hits on a lot of the physiological and anatomical ways in which our nervous systems become assaulted through both epigenetic influences such as toxins in the environment, as well as stress of different types, physical, mental, emotional, electromagnetic, and also how that intertwines with our genetic predisposition to the integrity of our nervous system. So it's both our genetic resiliency coupled with the impact of the various environmental stressors that in the end has a particular effect on the neuroplasticity of the brain and nervous system, which of course is the title of today's talk. So as we move on to the next slide, I wanted to first just show you some gross anatomical real pictures of what happens when we have a loss of neuroplasticity. And as you might have imagined, because we are natural healers, I'm going to also talk about natural ways in which many of these effects can either be reversed, mitigated in some way, or certainly retarded or delayed. And we're talking about neurodegenerative conditions. And it's recognized now that neurodegeneration is a real public health concern. And the earlier we intervene with these various impacts upon our nervous systems, and we'll speak about many different diseases and dysfunctions that are at this point epidemic in society, that's how we make a difference with people. For example, if we have a person with Alzheimer's disease, which is the gold standard of a neurodegenerative problem and a neuroplasticity problem, and we've identified, for example, that might be caused by the environmental metal aluminum, which is in fact known as the number one environmental cause precipitating degeneration in both the hippocampus, but also in an area in the nervous system known as the substantia nigra. You see on the picture in front of you, it's pointing to, this is an MRI, of course, of the hippocampus. We have degeneration. If we intervene once a person has a loss of mental cognition, and you chelate and or detoxify or remove the metals, it's too late. So we must assume a level of exposure to various toxins like aluminum and try to prevent these conditions. That's our best intervention. Now, as we move to the next slide, we're looking at a coronal picture MRI with some different colored arrows showing to areas of degeneration in Parkinson's disease. So we'll talk more about it later, but basically you should know that Parkinson's disease involves, among other things, the loss of dopaminergic neurons. And if these dopaminergic neurons fail to produce dopamine, which is the main neurotransmitter, what we have in Parkinson's disease is rigid movements, for example, what's known as masked facies, motor issues throughout the body, not so much cognition, but definitely motor. This is another example of one of these epidemic types of neuroplastic problems. Long before we see changes on MRI or CT, the patient is experiencing physiologic changes, chemical changes, and when those chemical changes get to a point where they don't support the tissue of the nervous system, such as the brain in this case, then we finally have macro changes that can be visualized on an MRI. So it's up to us, the natural practitioners, to recognize that fact so that if a person displays certain motor symptoms or cognition symptoms, and they see a neurologist and they say your MRI is fine, we realize that the MRI is always fine before it's not fine. So there's a level of degenerative changes that have to add up and accumulate before we see these visual changes upon MRI. And it's no different, for example, with mammography and breast cancer. It takes an average of 5 years for a woman to palpate a tumor or for it to be visualized on mammography. So again, we want to delay, we want to intervene far earlier. As we move on to the next slide, again, just different pictures here of Parkinson's disease. And again, this results in a reduction of dopaminergic neurons. But these pictures that you see in the center and to the right with the lit up areas, those are the hippocampus. So we actually have 2 hippocampal regions. So the hippocampus is the center. If I had to say what's the most important area of the brain to target nutritionally for prevention of neuroplastic diseases and dysfunctions, it would have to be the hippocampus. But we also can appreciate that the brain works in a networking fashion, as does all the health and a relationship with the environment. So we're talking about a holistic perspective, but the hippocampus degenerates. It shrinks, it loses neurons, it has a lack of nutrition in the hippocampus, for example. The hippocampus is the most concentrated part of the body, of the nervous system, or the body in general, of zinc, for example. So the importance of zinc in not just Parkinson's disease, but other neuroplastic conditions is extremely, extremely important. As we move on to the next slide, we're starting with a definition of what neuroplasticity is. So I'm going to read it to you because it's very important to understand this. So neuroplasticity is an umbrella term, and it refers to complex, multifaceted physiological processes that mediate the ongoing structural and functional modifications occurring at various times and scales in an ever-changing immature and adult brain. Let me stop there for a second. Simply put, we have the brain. The degenerative changes, when they exceed the regenerative changes, we have a loss of neuroplasticity. Neuroplasticity, that term is a positive term, meaning if a person possesses neuroplasticity, their brain and nervous system has the ability to reform and reconnect and regenerate the nervous system, which includes, of course, the neurotransmitters and the neurons themselves and other brain structures. So a loss of neuroplasticity is a loss of that. And depending upon the specific location or locations in the nervous system that the patient experiences, a loss of neuroplasticity will give us this or that disease or something in between, which is not recognized as some form of disease, but a bunch of symptoms and problems that a patient has, and the doctor says, I don't see anything. What I mean by that is, on one end of the scale, let's say on your right side, there's a healthy brain, lots of neuroplasticity. And all the way on your left-hand side is degenerative changes. And in the middle, there's the dysfunctional and dis-ease part of it. That is the part where we, as national healthcare providers, can make the biggest change. Although, it's essential to realize that it's never too late to restore any amount of neuroplasticity. Studies on adults of all ages, both male and female, show that there is no age within which neuroplasticity does not have potential to be restored, but that doesn't guarantee that someone will recover fully from their problem. At the end of this slide, I talk about vitamin E as the first example of a nutrient that we know exerts potentially life-saving effects upon the nervous system. For Alzheimer's disease, even traditional medicine recognizes that vitamin E should be supplemented. And for the reasons you might think, loss of neuroplasticity means we have degeneration of the nervous system. Part of that degeneration, as you might have guessed, includes inflammation. And when there's inflammation, there's oxidative stress. And when there's oxidative stress, we have a loss of antioxidant redox recycling. So vitamin E is essential as a fat-soluble nutrient. It's in very high content, of course, in fatty tissues such as the brain. So very important to use the mix of Cough-Walls with all matter of neuroplastic conditions. The only contraindication for using vitamin E in any of these patients would be if they're taking blood thinners such as aspirin or perhaps Coumadin. And that doesn't mean you can't use them. You just have to be aware that vitamin E may cause an a fluidity of the blood or bleeding tendencies that are undesirable. So as we move along, here is a list of a lot of different factors, conditions, and effects upon neuroplasticity. I'm just going to run down these quickly. Obviously, how one ages and the degeneration of the hippocampus and the prefrontal cortex, this is fundamental to loss of neuroplastic control. Alzheimer's disease is a condition of degeneration in the entire brain, as opposed to Parkinson's, which seems to be mostly in the dopaminergic neurons. That has some nutritional distinctions, which we'll talk about. Cerebral hypoperfusion, lack of blood flow, obviously is going to affect the health of neurons and other brain structures. And if we do not have proper blood flow, something that's not a stroke, but something less than that, aging, arteriosclerosis, atherosclerosis, lack of perfusion of blood and nutrients and oxygen exchange with carbon dioxide, you'll have tissues degenerating much faster, which will result in the next level here of cognition, learning, and memory issues. All three of those things and emotionality are linked to the hippocampus. We mentioned Parkinson's disease. That's an example of negative neuroplastic changes. Stroke, obviously, that's classic. You know, stroke is no longer killing nearly as many people as it used to, but sadly enough, these people are living longer with more disability, and it's a nightmare. So we have such an opportunity here to use natural medicine in almost entirely safe ways to not just reduce the number of strokes, but people who tend to have superior nutrition, some of the ways I'll be speaking about very shortly, tend to recover much better. Multiple sclerosis is an example of loss of neuroplastic issues with the white matter of the myelin and other areas as well we know now. Neuropathies and neurodegenerative conditions of various types. Neurotransmitter loss, remember, neurotransmitters allow those messages to go from one neuron to the next. So if we are not producing proper neurotransmitters, then clearly we have neuroplastic issues. Brain cell degeneration, many types of brain cells, depending on brain cell issues, we can have a different condition. Traumatic brain injury, that's a big one. That's been in the news for years now, starting with football players. But many people get traumatic brain injury from, just driving poorly or playing sports when they were children, and it has additive effects over time. You get hit in the head when you're younger. You might have a car injury, let's say. You get hit from behind. It doesn't seem like a problem, but it adds a little more to the brain injury. And then there's poor diet, and then there's lack of exercise, and then there's other epigenetic influences and genetic influences. And before you know it, it adds up to a society that between 20 and 40% of the statistics, depending on which ones you read, will develop some type of neurodegenerative condition, such as Alzheimer's dementia. We have minimal brain dysfunction. This is a very common thing where people are, losing their keys just one too many times in the refrigerator. They just can't remember a lot of things. This is different than attention deficit disorder, and it's extremely common. And people of all ages, but probably between ages 50 and 65. And then we have dietary factors that influence neuroplasticity, such as ketogenesis and caloric restriction and the intake of a high-fat diet or HFD, and of course vegetables and veganism and that sort of thing. And what you would imagine would be healthy for the brain as a naturopath or naturopathic student, you would be essentially correct. All of those things, there are studies. The use of nutritional supplements, in my humble opinion, is essential. We cannot do it all with foods, particularly given the toxicity and, as I keep saying, other epigenetic influences affecting health and well-being of the nervous system. Hyperbaric oxygen is an excellent treatment for all manner of neuroplastic issues for obvious reasons. Hormonal issues, loss of hormones in the brain cause atrophy and brain degeneration. Exercise, lack of exercise, not good. Okay. Too much, there's not really too much exercise, we won't get into that, but proper exercise for circulation, for lymphatic flow, for sense of well-being, for reduction of inflammation, all kinds of reasons are important. So we don't simply want to talk about diet and supplements for the patient, but those other epigenetic influences, such as exercise, are very important. And the use of supplemental steroid hormones. Let's move on. And again, oxidative stress or inflammation, part of the degenerative condition, loss of neuroplasticity. Synaptic plasticity, again, loss of neurotransmitters. And then there's something known as brain-derived neurotrophic factor gene, BDNF, which makes brain-derived neurotrophic factor protein, which, although we don't have time to go into this in detail now, you need to know, if you've ever talked with anyone who knows anything about neuroplasticity, they will know about BDNF and how it's important to enhance the production of brain-derived neurotrophic factor. And there is a natural therapy that I'm discussing today that has not been shown in some study to do this, which is remarkable, since even medications are not doing this in neurology. I'm going to jump around a little bit here. On the next end of this slide, hypoglycemia, low blood sugar in the brain is going to create issues, as will hypoperfusion of oxygenation and nutrition. There's this concept of excitotoxicity. Too much excitotoxicity tends to be related to brain degenerative changes. We have a loss of ATP in the neuronal tissues, which means we have tissues that are just decaying. And then there's the influence of electromagnetic radiation and other types of influences which pass through the nervous system, causing degeneration more or less in people that are susceptible. And I wanted just to mention things, again, an epigenetic influence, like noise. Chronic noise is known to promote loss of neuroplasticity. Let's move on. Neurotransmitters, as I've mentioned a few times, are essential, and we'll be talking about nutrients that we can supplement that are known to be absorbed and increase the levels of neurotransmitters in the brain. 80% of the neurotransmitters in the brain are derived from the diet. And there are receptor sites in the small intestine for monoamino acids, dyes, tris, and poly and oligopeptides. So we have receptors for all of these different chain lengths of amino acids. It's not the old knowledge that we thought in gastroenterology that, if you eat a protein, it's all broken down into single amino acids, not dipeptides, tripeptides, oligopeptides, but we know that's not true. And these different chain lengths of amino acids help to support different neuroplastic structures in the nervous system. Next slide. And then I just wanted to mention that of the different types of cells in the nervous system, we have astrocytes, for example, and microglia cells, which are supportive cells. And the last bullet here, the glia, for example, can change its activity and the expression pattern of many factors that modulate synaptic plasticity. In other words, these supportive neurons, which can be supported through nutrition and lifestyle changes, positive lifestyle changes, are known to literally be able to change the physical structure of the brain. And that is what it's all about. The next slide. Okay, let's be practical here. Now, I'm going to mention some nutritional supplements. Not all of them will be found on our summary sheet, but I do want you to be aware of the importance of curcumin, particularly the type that Nutritional Frontiers makes, because it contains piperine, which is, the trade name I believe is biopterine, and piperine is from black pepper fruit. And that particular compound has been used for years in the pharmaceutical industry to improve the absorption of a variety of medication by hundreds or even thousands of times. And in one study I read, when dietary curcumin and curcumin supplementations are combined with biopterine, you increase its absorption by nearly 2,000%, which is unbelievable, which allows for all of these amazing potential effects of curcumin that you read in studies, such as anti-cancer effects in cardiovascular disease and neuroplasticity. Personally, I take loads of curcumin with piperine. It's a fundamental herb that I take, or combination herb. And as you can see here, it's an extremely potent antioxidant. It reduces oxidative stress on neuronal function, even in those with traumatic brain injury. And this is well studied. And this is the actual title. Dietary curcumin counteracts the outcome of traumatic and oxidative stress, synaptic plasticity, and cognition. So that is an amazing statement. And sadly, curcumin is not a mainstay treatment for those with any neuroplastic condition in traditional health circles, but now you know about it if you did not before. So we'll move on to the next slide. And I wanted to mention on this page, basically, that if you're dealing with neuroplasticity, to improve neuroplasticity, you must focus on ketone body production. So I named a few different ketones on this page, but proteins, of course, such as whey protein and other proteins, and also medium-chain triglycerides, which are found in coconut oil, or medium-chain triglycerides that have been extracted, particularly between an 8 and 10 carbon length, will very effectively, as will whey protein, increase ketones measurably. Ketones are the major reparative fuel for the central nervous system. I have seen computer programs that measure brain mapping and purport to mention specific nutritional supplements for the health of the brain, and they don't even have medium-chain triglycerides or protein on the list, which tells you right off the bat that whoever put that list together knows nothing about neuroplasticity. So extremely essential and fundamental. Next slide. I've mentioned vitamin E before, but I also want to mention two things, that vitamin E and also vitamin C, and of course there are several other nutrients, including N-acetylcysteine, they tend to remove and or mitigate the effects upon the nervous system of heavy metals. So this was a study where they looked at the lead levels that were associated with cognitive impairment, and it affected what's called, this is a new term, everyone, it affected what's called long-term potentiation, LTP. That's another term that if you think about neuroplasticity, you must know. In short, long-term potentiation is the term that refers to the ability of the nervous system and the hippocampal regions of the brain to maintain cognitive function. So you might guess that any positive changes would improve long-term potentiation, and you would be right. Vitamin E can do this, curcumin can do this, vegan diets can do this, properly proportioned protein diets and or fat diets that promote ketogenesis do this. And this study showed that vitamin E alone will not only mitigate the effects upon the brain of cognitive impairments, but lowers the level measurably of the oxidants of cellular membranes. And they mention one here in the middle paragraph called malonyl dialdehyde, or MDA, which I measure on every single patient. It's one of these overall important biomarkers. So yes, you want to chelate metals out, that's great, but you also must supplement the patient appropriately. And if you measure on blood or urine, which both are considered relatively equivalent biomarkers, malonyl dialdehyde, to know you reduce the body burden of oxidative stress, then you know you've really made a difference. Move to the next slide. And this is, of course, a positive study on the effects of vitamin D supplementation on neuroplasticity in older adults. It was a double-blinded study, placebo-controlled, and everything. It's amazing. And the effect of vitamin D, I'm looking at the second bullet, on neuroplasticity, were that it increased the brain-derived neurotrophic factor, that complicated stuff I just told you about that you need to know. And it also improved muscle function. It reduced falls in people. Why does it do that? Well, vitamin D reduces falls in older adults because it strengthens neuronal connections, not just in motor regions, but in many other regions. Remember, vitamin D, D3 on a blood test, should be at a 70. The range is 30 to 100. 50 is average. 70 is what the meta-analysis says is the optimal dose for vitamin D. You know you're overdosing with vitamin D if someone's calcium goes up. You just stop the vitamin D until the calcium goes down, and you start again with a lower dose. Or, you know you've overdosed someone if their liver enzymes increase. Once again, you just continue the D, liver enzymes come down, start again with a lower dose of D. So it's not enough to just supplement with the right D or right E or right curcumin. You need to give the right doses. How much curcumin should you give? Just to jump back to that for a minute. Well, I measure body composition to figure it out based on lean body mass, but I would say between 4 and 6 grams, along with the piperine, for every gram or so of curcumin. Probably we're dealing with about 40 milligrams of piperine on average would be ideal. Let's move on. And here is vitamin C, showing something very similar to vitamin E on the last slide, that vitamin C reverses neurotoxic lead-induced deficits in the hippocampal synaptic plasticity in the RASP. That's amazing. In the actual area of the hippocampus, neurotoxic effects. And this was in, and that the vitamin C enhanced the ability of the nervous system to work better by affecting these different measured parameters known as EPSP and the PS amplitude. You can look into that more on your own if you'd like. And we'll move on. And of course, ubiquinone, which is ubiquitous. It's everywhere. So, and of course, the mitochondria. We know that ubiquinone is an antioxidant. It's a strong antioxidant. It is fat soluble. It gets in the nervous system. Let me read the first bullet. It talks about Parkinson's disease. Again, that's associated with the dopaminergic concerns. The second most common neurodegenerative disorder after Alzheimer's, affecting 1% of the population older than 50. Now, what this also says as you move down is that the very last bullet, that Parkinson's disease, CoQ10 is able to attenuate the toxic effects that cause loss of neuroplasticity of a very potent neurotoxin known as MPTP. And that is, very few people are going to be exposed to that. And if CoQ10 can mediate that or mitigate that, it can many other toxins, which have actually been well studied. So every single person that I deal with a neuroplastic problem that's on that big list I gave you at the beginning, or any other one we didn't talk about, needs to be on CoQ10, needs to be on a whey protein and or a medium chain triglyceride, needs to be on curcumin, vitamin E, vitamin C, and as long as there is no specific contraindication to doing that. So this is pretty easy when you think about it. Everyone with any neurologic anything, these are your considerations. Move to the next slide. So I just wanted to mention here that we know that steroid hormones are neuroplastic potentiators. So for example, DHEA, which is an adrenal hormone. I'm not speaking at the moment about DHA, which is extremely important in neuroplasticity, among other things. But DHEA is a major adrenal hormone that declines at about age 25 to 30, more like 30, 35 actually. And as it declines, we lose certain connections in the brain. And of course, there are many effects of DHA upon the rest of the body. So we'll have to just limit this to the nervous system and neuroplasticity. But basically, it's an anti-catabolic hormone. That's a good thing, meaning it helps to delay and or reverse atrophy of the brain, which means problems with neurotransmitters and or problems with various neurons and cells of the brain. It's also a very potent antioxidant, which isn't so much appreciated. So I start people with about 25 milligrams of DHA. I have them take it in the morning because that mimics normal body rhythms where DHEA is highest in the morning. And as long as they're not complaining of, growing a mustache or hair in all the wrong places or acne under their chin, on their back, for example, then I would increase it every 2 weeks or so, even up to as much as 100 to 150 milligrams, and even higher, particularly if there's evidence of other issues that are, let's say, concomitant with neuroplastic changes, like anything autoimmune, such as lupus or pretty much anything else. The only contraindication to DHEA, like testosterone, would be in a woman, let's say, with PCOS, polycystic ovarian syndrome. And let's move to the next slide. So seizure-induced oxidative stress in temporal lobe epilepsy. So basically, what this is saying is that any of these neuroplastic problems, whether it's epilepsy or Parkinson's or Alzheimer's disease or multiple sclerosis or minimal brain dysfunction or any other level of cognitive issue, there's always oxidative stress. I used the term earlier when I was talking about ubiquinone, CoQ10, that it is an antioxidant, and it is potentially, and the same for vitamin C and E and curcumin. When I say potentially, the body takes these compounds and uses them to balance what's known as oxidative reduction reactions, redox balance, which means if the body requires oxidants, then it maneuvers these compounds so that that oxidation happens. Maybe the oxidation would be a beneficial thing somewhere in the body, or it would do the reverse and have these compounds become antioxidants. It's similar to what happens with people who receive intravenous vitamin C, let's say for cancer, which is super well studied, by the way. Vitamin C intravenously is not an antioxidant. It's well known. It's not even an argument It's not, it is an oxidant because oxidation kills cancer cells. Just a little side note there. Let's move on to the next slide. And this is talking about seizure control with medium chain fatty acids, or MCTs. Your patients will ask whether or not taking MCTs will increase their triglyceride levels, and you tell them the truth. You say it will reduce them, is what they do. And there's an explanation for that, but we don't have time to discuss it. But I wanted to emphasize here that medium chain triglycerides, or coconut oil, which is about 40 to 60% medium chain triglycerides, is a fundamental supplement for anything neurologic, as I mentioned earlier. You can also increase, because it also promotes NCT's ketogenic effects. Now, the ketogenic diet is a nice idea, but as many of you out there know who practice, ketogenic diets are, at least the old version, is super unhealthy. So it might cure your seizures, but you'll get a heart attack. Then there are healthier ways of promoting ketosis through the diet, which are very, very difficult, to the point where I find in my 27-year-long practice, it's just too much for people to do. It's neurotic, it's stressful, when it is not needed. We want to make whatever healthy changes we think the patient can manage that are best for them in their diet, I would say. And then when you supplement things like whey protein and MCT oil, you will make that patient ketotic. And you don't have to believe me. All you need to do is measure their blood or their urine ketone levels, and they will skyrocket. It's easy to do. And I was very surprised to see on PubMed.com, which is the National Library of Medicine database, that they have looked at this, and they find that this, in fact, is true. They said exactly what I just told you. The diet is not necessary. It's not even as reliable as using supplementation to push ketosis, which is reparative. So really what we're talking about here, the important distinction is that any neuroplastic improvement that we want will promote, on one level or another, ketogenesis. Now, ketogenesis may have an adverse effect in some cancers because ketogenesis involves the production of keto acids. And keto acids are acids, and they can lower the blood pH. And when you lower the blood pH, that would be an adverse thing in most cancers, but that would be a potentially beneficial thing for anything neurologic. And I'm not talking about huge changes in blood pH. You might want to listen to a radio show that I did called pH Lives, which you can find under my blog section on my website at blooddetective.com. I go over the chemistry there. If the average blood pH is 7.4, which it is, a pH of 7.3 could be dramatically helpful in neurologic conditions, but it takes a little work to get there. Blood pH is very, very different than urine and saliva pH. Those pHs change every 2 minutes. You can literally jump up and down and change those pHs. You cannot do that with blood. Okay, listen to that show if you can. And then I mentioned magnesium. Magnesium is the most abundant mineral in the brain, so I like to provide that along with a multi-mineral complex. And basically, I like to use that until I first start out with a pure magnesium until a person meets their intestinal tolerance. They'll get some loose stool, because I want them to have as much as they can tolerate, and then I back off. And it's a great therapy, obviously, for constipation, but you want the patient to have as much magnesium as possible. It's needed for nearly 500 different enzymatic reactions. Vitamin C, by the way, for about 3,000. Zinc for about 175 to 195. So it's pretty interesting how many enzymatic reactions are required by these nutrients. Let's move to the next slide. Resveratrol. I love resveratrol. It's right up there for me with curcumin. I take loads of it myself. Resveratrol pre-treatment. Look at the second bullet here. Pre-treatment effectively restored synaptic plasticity in a certain subgroup of rats that were affected by cerebral hypoperfusion. In other words, they basically gave them a vascular dementia by starving their brains of oxygen, and pre-treatment made a dramatic effect upon recovery. That's what I meant earlier on. Of course, most of our patients who feel well will probably not pre-treat themselves with resveratrol, but if we can, like I put every patient on Resveratrol for any health problem, as long, again, as there's no contraindication, and every other supplement that I mentioned so far. Let's move along. And this particular slide, if you look at the top, it talks about a novel application of brain-targeting polyphenol compounds, and it talks about sleep deprivation. But I put this up here just to remind me of two things to relate to you. Number one is problems with sleep will result in many adverse outcomes, including promoting degenerative neurologic potential in people. And secondly, that polyphenols, which are compounds found in plant products, are dramatically important for everyone's health, particularly, well, that's not true, not particularly neuroplastic, for everything. Plants are fundamental. So we're going to talk about these superfood powders that are provided by Nutritional Frontiers, which I love and I use. I give them to every single patient. They taste great, and the person is getting dozens and dozens of nutritional equivalents of fruits and vegetable intakes. So no matter how bad a person's diet is, if they did nothing else to improve it but just drink this, that would be pretty dramatic. But of course, we would like more for their patients. Next slide. And acetyl-l-carnitine. Acetyl-l-carnitine restores synaptic transmission, that's a good thing, and enhances the inducibility of stable long-term potentiation after oxygen glucose deprivation, which means glucose deprivation, hypoglycemia, and oxygen perfusion issues both adversely affect the brain. But acetyl-l-carnitine has an ability, and it has to be the acetylated form of L-carnitine. You need that carrier to restore synaptic transmission by stabilizing LTP, long-term potentiation. Again, remarkable stuff. So we know, as the last bullet says, this study revealed that acetyl-l-carnitine is neuroprotective and it's regenerative. Next slide, please. And this is, again, just another slide that reminds me that plants, again, are amazing, and plant sterols in particular are important for brain stability, not to mention lowering of cholesterol. So the first bullet here is a very, very important concept. Cholesterol reduction at the neuronal plasma membrane has been related to age-dependent cognitive decline. So the brain is fat. The brain is made of various brain cells. The brain cells contain cholesterol. Therefore, cholesterol is the main structural component of the brain. And most cells, every cell of the body that has a cell membrane, by the way. Anything that reduces the cholesterol in the cell membrane beyond a certain point will reduce neuroplasticity. The thing about cholesterol is that, number one, provides structural integrity to the brain. Number two, cholesterol is an antioxidant. It's made of a ring structure, a very complex ring structure, known as a cyclopentanoperhydrophenanthine ring. And I remember learning that years ago. I was so fascinated with the structure, I remember the name. But it's got these ring structures that look like stop signs taped to one another, except they trap free radicals. So if you lose cholesterol in the brain, you can't trap free radicals. And then what happens? Oxidative degenerative changes. So plant sterols, or most plants, particularly the superfoods plants that are what we talked about in a moment, and they're extremely important for not just lowering cholesterol to a point that is biologically helpful. In other words, plant sterols will not lower cholesterol in the brain beyond a balancing, what's the word I'm looking for, adaptogenic level. But statin medication, for example, which has been associated with increased risk of, let's say, suicide and depression and other mental disorders, many mental disorders, by the way, that will. And that's one of the mechanisms why cholesterol medication can adversely affect neuroplasticity. Let's move on. Magnesium, we talked about that before. We're going to move on from this slide and to the next one. Long-chain fatty acids. We want to give every patient, again, unless there's a contraindication, omega-3D liquid, which is Nutritional Frontiers fatty acid that I'm familiar with, because The EPA and DHA both help the structure of the nervous system. They are both antioxidants. They both affect short-term hormone production. They provide structural integrity to the brain. And the DHA portion in particular is more important than the EPA portion for the nervous system, whereas the EPA portion is more important for cardiac issues over the DHA. But there is obviously an overlap. So EPA DHA in a liquid form is very tolerable to take rather than people having to swallow 10, 15, sometimes 20 capsules a day, which results in digestive issues and regurg and all of that. The omega-3D liquid is extremely tolerable, tastes great, and gets in the brain. We know it gets in the brain. And there were studies, I'm not sure if I mentioned it in this particular talk now, but they noticed improvements in long-term potentiation in at least one study that I remember with a single oral dose of EPA DHA. Let's move to the next slide. More good stuff on omega-3 polyunsaturated fatty acids. And we'll move on to the next slide. And this basically is just underlying what I have been saying all along, that age-related changes in long-term potentiation, which has to do with the ability of the nervous system to get the signals going. So long-term potentiation is a good thing. Loss of it is a bad thing. Oxidation causes a loss of LTP. So antioxidants like lipoic acid are extremely important. So lipoic acid is both a water and a fat-soluble antioxidant, and it does cross the blood-brain barrier, and they very quickly measure lipoic acid concentrations in the brain increasing after oral doses. So it obviously mitigates a lot of oxidative stress. It is essential for diabetic neuropathies, very well studied for that. I use it for every form of neuropathy. It's extremely important to lower blood sugar in diabetics, and lipoic acid does it very quickly. A few people have caused hypoglycemia temporarily because they gave them too much. So if someone's feeling dizzy, then they might actually be taking too much, so you just back off a little bit. Let's move to the next slide. And just to mention, as I said earlier, that the effects of aerobic exercise on hippocampal volume was looked at in a systemic meta-analysis. So we can't just talk about diet. We can't just talk about stress or supplementation. We need to get people exercising. Next slide, please. And of course, this is almost insulting to naturopaths, but we want foods that are grown in nature, and we want to eat lower down on the food chain as an overall rule for health, but certainly in neurodegenerative conditions. Not just because of the antioxidant effects of vegetables, but there's just so much to say about them, and the same is true for fruits. Next slide, please. I quickly wanted to let you know that I provide blood detective reports to practitioners. The long and short of it is it can give you all of these things when you put the results of the patient's blood work in the system. So you're typing it in, and then you're choosing a few options, and it gives you what supplements to take for patients' specific chemistry and what foods you might want to more strongly consider. So the reports are $25 per patient report. You might charge $50, I charge $130. So you can find out more about that here. And as we move on here, I'm giving you an example of a report, a blood detective report, where on the far left, we see the blood test. And then as we move towards the right, we see the results in that patient and how there are high and low values compared to clinical ranges or average ranges. And then I have the healthy ranges to the far right. If you compare someone, as I do, to ranges which are associated with a healthier segment of the population, they, of course, are going to have many more abnormal findings. But each of those findings gives you a better picture of the overall nutritional needs of the patient. So we're talking about, in this neuroplasticity talk, about the basics of just things that you've got to use supplement-wise, and some food concepts and lifestyle concepts for neuroplasticity. You can go further in any patient, not just more difficult patients to treat, by doing this sort of report, which will then also, if you move on to the next slide, tell you, what does the test mean? What does that high or low level mean nutritionally and medically? What other tests should you think about? Again, what supplements should you take, or should the patient take? And let's move to the next slide. And this is just an example of some of the printout that was which is included in this patient. For example, it mentions doing a thyroid panel and ordering gliadin antibodies, which are produced from gluten in susceptible people. Gluten has been shown to cause cerebellar atrophy, for example. And, or it might say, as it does on this page, consider measuring estrogen levels in this patient with their particular blood results. So this is very, very personalized. Next slide, please. This is just a larger picture of everything I've been telling you about. We'll move on to the next slide. Here's just a small picture of a 10-day breakfast, lunch, dinner, snack food plan, which was chosen for the patient based on the blood work that I would then say, here you go. We'll move on. This is interesting. This shows you to the far left that the patient has these different body system weaknesses. As you move towards the right, you see a clinical and a functional column. And basically, if you look, for example, at hormone balance in the middle, it says that the patient has 8 abnormal tests when they're compared to average people, and also they happen to have 8 as well when they're compared to the healthiest. Since that's like one of the higher level abnormalities here, although the nutrition one at the bottom is actually the highest, you might choose foods and supplements based upon maybe just that 1 weak body system in a patient, or you might choose their top 2 weakest systems as opposed to treating everything. Okay, we'll move on. So here is a supplement list of what is provided by Nutritional Frontiers. Let's quickly go down this list. Amino acids, we need those for neurotransmission. So we first always start with the doses recommended on the bottles, and many people, particularly with these sorts of conditions, do need higher doses. And there's astaxanthin, which we have not talked about yet. There is a more detailed slide coming up, but it is a very, very potent antioxidant in the central nervous system. Brain Boost 2 is again, we're going to talk about it later, it's a plant super nutrient superfood. And then we have Calm Day, which I want to say a little bit more about here. Well, actually, you know something, I won't. I'm going to wait a little further as we go along. Then we've got DHEA, which is a hormone we talked about earlier, magnesium, the vitamin E, Neuromax, which is sort of a combination of some other fundamentally important nervous system supports. Pregnenolone we have not mentioned. That's very similar to DHEA in that it's a nervous system stabilizer. And the next one, the Pro-Red, the green, the orange, and purple, I use them, as I said, on every single patient. I cannot think of a better thing that I can do so quickly than have my patient take a scoop of each of these, diluted all together in water once or twice a day for their overall health and well-being, and to cover literally tens of thousands of phytonutrient compounds, many of which have been studied for all manner of health effects, including neuroplasticity. And then the Super Shake, which can promote ketogenesis. Let's move to the next slide. So here we are with the details with some of the supplements. The amino acids, there's obvious reasons to use them. They're on the left. I'll mention just a few of these amino acids and how they impact the nervous system. For example, L-glutamine, the second on the list here, that helps, of course, the gut, but gut issues and leaky gut is associated with problems in the brain and neuroplasticity. And that leaky gut is not what you would think. It's not only the small intestine, it's also the large intestine. And then if we move down here, for example, we've got L-leucine. L-leucine is needed to maintain structural integrity of the lean body mass. A loss of lean body mass is associated with increased risk of dying of anything, and morbidity and mortality like neuroplastic problems. So I start patients here with, this is a capsule. I never start with one. I'll start with probably 2, taken away from food is how I like to do it, and then I'll increase from there based upon response. The average dose I'll give a patient is usually 2 of them twice a day, about 15 to 20 minutes away from food, because amino acids in general seem to be better absorbed away from food. And then I mentioned we have astaxanthin before. All these different functions listed here are wonderful. There isn't mention of its neuroplastic effects, but it's very well studied. And we'll stick with the 1 milliliter. 1 to 3 milliliters is what I would use for neuroplastic problems. Right under the tongue, hold it for 10 seconds, 15 seconds, and swallow it. And then the Brain Boost. So this is a plant-derived mixture of compounds which also emphasizes specific things that have been well documented to improve neuroplasticity. And you can see some of them in the supplement facts section, like ginkgo and vinpocetine and huperzine, unbelievable huperzine. And that's actually what's known as huperzine A. As we move along, we've got Calm Day. So the thing about this particular product is that it has in it, as you can see under the features, the 4-amino-3 phenylbutyric acid, and that's known as phenibut or phenibut, depending on how you want to pronounce it, and that helps calm the central nervous system, and it also improves what's called GABAergic neurotransmission. That is a good thing when we're dealing with improving neuroplasticity. Also, that particular element here is fantastic for reducing pain, increasing mood, increasing quality of sleep, decreasing anxiety. It's been studied in PTSD. It's been shown to help tips, motion sickness. I mean, what else can I think of here? Alcoholism even has been shown to, it helps offset the withdrawal effects. That's just one thing. And the combination of the 4-amino-3 phenylbutyric acid along with the synergist taurine and glycine plus B5 and B6 makes it fantastic as a neurotransmitter, a neurologic supportive agent in so many fascinating ways. And in terms of the dose here, I usually start with about 4 capsules. And when you give a patient a dose that's beyond what the supplemental facts say, you want to let them know that so they don't think you made some sort of mistake. It's a little clinical trick that I found. You don't want to forget to tell them that you're using a dose different than what's on the bottle. And then DHEA, I've mentioned that earlier. We can see all the different effects that it has that are positive in the body, but it has been shown to offset atrophy of the brain, the cerebral hemispheres, and also the hippocampus. And again, the DHEA 25 is the starting dose, and that it would be taken in the morning. I do not like the idea of people, I've seen them do this, some practitioners, giving DHEA throughout the course of the day. If you're a bodybuilder, well, they might do something like that, but that's not a healthy way to use it. We want to have it in the morning, and again, anywhere between 25. Average dose for people is probably 75 to 100 milligrams, and I mentioned earlier we could go higher. Let's move on. And then liver clear. The liver has over 500 functions that we know of, and a lot of them are related to the brain. I just love this particular formulation here because not only does it have, the turmeric root extract, which I love so much, but it has the N,N-dimethylglycine. We haven't mentioned that. That has independently been studied to help offset loss of neurons. When we talk about these different nutrients helping neuroplasticity, they help them in some very, very different ways, and also some of the very same ways or similar ways. So, for example, if I say that N,N-dimethylglycine helps to reduce neuronal damage, it helps the neurons resist oxidative stress. Vitamin C and E help reduce specific types of oxidants, but not the same ones. So when you're speaking with a patient, it's important to say that, I know I've mentioned the term oxidation a bunch of times as I'm describing your nutrients, or anti-inflammation a bunch of times as I'm describing how your nutrients will work, but they work in different ways. Because they will think at some point that they're taking too much, or why is it so redundant? Okay? And we'll move along from this slide of liver clear. And there's the magnesium complete. So we've got magnesium taurate, magnesium glycinate, magnesium malate. You just don't know what person or what patient will manage which magnesium will be best for them. So I like this combination very much because we've got some distinctly different types of magnesium carriers that can move magnesium in different pathways, and it just covers a lot of bases. And we talked about how important magnesium is in the central nervous system and also cardiac issues. And magnesium is even an antioxidant that's not commonly known. And we've got a nice dose here of 300 milligrams. Let's move along. And we mentioned vitamin E, the natural tocopherols. They help the integrity of the neurons in the brain. They help improve the receptor sites in the brain to neurotransmitters. And of course, vitamin E is anti-inflammatory. It improves circulation in the brain. Again, there's so many ways in which these nutrients work. One last thing I'll mention is vitamin A. As you know, it's the last bullet here, regulates blood viscosity. Blood viscosity is promoted by inflammation, and there's a stickiness of cells. That fusion of blood, that is a term that means getting the oxygen deep into the tissues. It even may affect nutrient delivery. It certainly increases cardiovascular risk. So, and just degeneration everywhere. If and I just presented a seminar to some oncologists and cardiologists, and what was interesting about both of these professions is most conditions they deal with result or have the feature of increased blood viscosity, which is a bad thing. It's never good. Next slide. Neuromax, as it says, it's a very good overall nervous system support. What we've got here is the active form of B6, known as pyridoxal 5-phosphate, which runs lots of neurotransmitter reactions and neurotransmission. We've got folic acid, which works well with vitamin B12. The B12 here has got two forms, the methylcobalamin, which is that methylated form. A lot of the neurodegenerative conditions have a methylation issue, which affects the healing. And then, of course, we've got some more magnesium here, some zinc, which we need for that hippocampus. Remember, the hippocampus in the brain, we have two of them, is the most concentrated source of zinc in the body. And then there's dimethylglycine, which, among other things, improves absorption by promoting stomach acid secretion, which we need to ionize and digest all sorts of things, obviously, from calcium to iron to amino acids to cleaving B12 from proteins. And it's an antioxidant, and it is stabilizing to the nervous system. Next slide. And the omega-3 liquid, which I was talking about before, there's not much more to say on that, other than it's got a great ratio of EPA and DHA, and I'll start someone with 1 teaspoonful. Now, if a patient says, I didn't tolerate it that well, it's coming up on me, that might mean that you need to give them less, or it might mean that you need to give them less and they need lipase enzyme, because lipase helps break down fat. So it's sort of like a tolerance test, giving someone omega-3 for whether or not they need enzymes for at least a lower dose. And you know they had an enzyme deficiency if they don't tolerate the omega-3 liquid, so you reduce the dose, and then you give them enzymes with lipase, and then you do that for 2-3 weeks. Then you add the higher dose of omega-3 liquid back, and they tolerate it just fine. Okay, and I like to keep people on enzymes for a good long time, a good 6 months before I start to taper them off. And I like to use the enzyme combination, which has some stomach acid along with some bile support and pancreatic enzymes, which is also what Nutritional Frontiers provides. And we'll move on to the next slide, which is PowerQ 600, which of course is CoQ10. We get 300 milligrams of activated CoQ10 there, and we've got 300 milligrams of the synergistic N,N-dimethylglycine. It's just a fantastic combination for so many reasons beyond this very short talk, which we're about to end. And then pregnenolone. Again, pregnenolone is high up on the hormone food chain. So we need pregnenolone. It will make testosterone, and testosterone makes DHEA. And by pregnenolone making testosterone, testosterone then makes estrogen. And when you start providing people with pregnenolone high up on the hormone food chain, that tends to trickle down in more of a biologically friendly way, as opposed to when you just give someone, 17 beta estradiol, which, will not be a good idea. So when people have these neurologic issues, when you determine that they really have these things, sure, are there some possible negative effects of maybe DHEA or pregnenolone? Well, yes, everything might have that potential, but the benefits far outweigh anything negative when these are used appropriately and at the starting doses here. But they are a part of neuroplastic improvements that are ignored and missing from many, many protocols I've seen of patients that have come to me. They're just not there. We want to hit all the major mechanisms that we can think of that manage neuroplastic potentiation, hormonal, antioxidants, removing of toxins, improving oxygen delivery, reducing inflammation. I think you get what I'm saying. Let's move to the next slide. And then, again, super excited because I love these products. I sell a ton of them. I drink half of them myself. But the only contraindication to maybe the green one would be if someone is starting Coumadin which is an anti-clotting agent, and you do not want them to be adding extra vitamin K, which you would find in the green products. The green. If they've been on the green products for some time, and for some reason or another, they're recommended Coumadin, which is warfarin, you do not remove them from it. That is known to be wrong these days. Like they used to say, you're on a blood thinner now, stop eating all the veggies with vitamin K. They know that was wrong. That made worse complications. They keep what a person's been doing. You want to rock the boat, and that's basically the concept behind keeping on it. And then there are some, every label with Nutritional Frontiers, very responsible, gives you some idea of some possible contraindications. Just read your labels, know those labels. These are super safe. And I use all of them but sometimes I'll start someone on a half a scoop of each mixed all together. And other times I will use a full scoop, even more than once a day. It depends on the patient. I met with a woman today, 44 years old, 160 pounds. She's this athlete. Her body fat was higher, though, relative to her lean mass than I wanted to see. And she had various concerns with her memory. But also, she's a serious athlete. I think that her athleticism was depleting her of nutrition, like proteins, robbing her of that, so she didn't have enough nutrition to make neurotransmitters. My point here is you want to look at the entirety of the patient and what they want to do. I don't know about you, but sometimes I'll sit with someone and we'll figure out a whole plan, and then they'll say, "By the way, Dr. Wald, I'm gonna do a triathlon." Well, that changes the nutrition. It changes everything. It's a stress. We have to know what they're doing in all aspects of life. So a good intake with your patient is essential. And the next slide, please. And Resveratrol, I talked about how much I love that stuff before. The number of studies on Resveratrol and neuroplasticity, I personally will not live long enough to read them all. There's that many. I mean, there are hundreds and hundreds of them. So it's just astounding to me when someone in the, some practitioner that doesn't use nutrition will say to me, "Well, there's no evidence." I don't know what to do with that statement. You just need to go to the National Library of Medicine or the Cochrane database to see the plethora of information. Let's move to the next slide. Sleep time. So we talked about this before. It's similar to Calm Day. It's got the phenibut in it, which is the first ingredient over here, and other synergistic issues. The thing that makes this special, though, is the presence of melatonin and a very good dose of 3 milligrams. This should only be taken at bedtime. It's not, melatonin is never to be taken at any other time unless someone is a night shift worker and has been for a long time. You can promote all sorts of adverse issues, including increased risk of breast cancer. But melatonin is a very strong fat-soluble antioxidant, independently studied for neuroplastic health. Anti-cancer doses are around 12 to 50 milligrams. So, depending on the patient and their issues, you might give, the supplemental dose will vary, but this is a good start. The next slide, please. Vitamin D3. We talked about that before. Vitamin D3 here is in a dose of 5,000 international units. If someone is low on their blood test of vitamin D3, it's best to give them 50,000 units a week for 8 weeks. And then you recheck their blood level, and then you supplement them based upon where their level is then. Studies have seemed to show that if you give 50,000 within 1 or 2 days, and you do that for 8 weeks, that you fix the vitamin D level safely and much more quickly than the traditional way, which goes something like this. Your patient says to you, "Yeah, my doctor checked vitamin D, and they said it was low." And then I say, "What did they tell you to do?" And they said, "Take some D, some ephemeral dose." They don't even give a dose, or sometimes they give a dose that's too low. So it needs to be, if your level of vitamin D is, I would say 50, which is considered average, and you want it at 70, I would take 5,000 units for several months, 6 months or so, and see where the level is. If it's not at 70, then you know to take more. If you're not testing, then stick with 5,000. If the person is super thin, then you might want to go even lower. Maybe it'll be 5,000. When I say 5,000, I mean per day. But if someone has a small body mass, you might want to give them 5,000 maybe twice a week to avoid bioaccumulation of vitamin D, which I've never seen in 27 years, but I thought I'd throw that out there. The next slide, please. Basically, this says that high-fat diet affects adversely insulin resistance. Insulin resistance is, you better believe it, associated with all sorts of neurologic dysfunction, including mitochondrial functional impairment. Next slide. This is just the summary information from my blood detective reports in case any of you are interested. And I want to thank everyone for listening. This was a lot of information. I know I spoke fast, but if you're serious about maximizing your patient's health with neuroplastic issues, you'll want to listen to this a couple of times. And I also believe that Nutritional Frontiers offers some discounts over a particular time for the supplements specifically mentioned in the talk. Thank you very much.
Yes, I want to thank you for listening, and we will get this recording out to everyone. And if you have any further questions, feel free to reach out to Dr. Wald or Nutritional Frontiers. They would be happy to answer any questions. And I just want to thank you again for listening. Have a great day, everybody.